Hi guys, my name is Dr. BiBi and welcome to my YouTube channel. Woo, that was really weird to do. So a little bit about myself. My name is Bianca Uzoma. I am an internal medicine prelim intern and upcoming dermatology resident. And at some point along the way, we can get into what all of that even means. But for now, I am in my first year of practicing medicine. Yeah. So I created this YouTube channel to reach people interested in pursuing a career in medicine. I also want to use this platform to empower people to participate in informed skincare and beauty practices. Lastly, I ultimately want to help bridge the knowledge gap between patients and physicians, as well as between pre-medical students and residents like myself through free online content such as this. I am really excited, clearly. So if you are interested in pursuing a career in medicine, learning what life as a training physician looks like, or if you're interested in how to match into dermatology, if you want to learn simple, realistic, budget-friendly skincare, and if you ultimately just want to be more informed when it comes to the day-to-day decisions that you're making regarding your health, then you're going to want to subscribe to my channel. Anyway, a little bit about myself. I was born and raised in the Houston, Texas. I pretty much always knew I wanted to be a physician. And so by the time I went to college at the University of Texas at Austin, I fast-tracked my pre-medical process. I graduated in 3 years and went straight into medical school after graduating college. That, of course, was an additional 4 years. I finally matched into dermatology in March of 2022. I graduated from medical school in June of 2022. And now I am already halfway through my intern year of residency. Sorry. Yeah, that's crazy. That's crazy. So I always knew that I wanted to become a physician one day. And for me, that was because I loved science and I loved people. Now, I know that sounds really cliche, but specifically, I just loved the objectivity of science. I loved the idea of evidence-based practice. I knew that I wanted to become an expert at something. I just love how pure and regimented that medicine is. And for me, I rely and flourish in that kind of stability. And I love that once I knew something, that knowledge would then be my power, and that would be, for the most part, pretty consistent throughout my career. And I just love being able to offer that objectivity to my patients because a lot of healthcare is just being informed. Now, I think the other part of why I chose medicine, and arguably the most important, is just my love for people. Again, I know it sounds pretty cliche, but you truly need to have a love for people and for humanity if you are thinking about choosing a career in medicine. Pursuing medicine is truly one of the most selfless things that you can do as a young adult. You're sacrificing your 20s. You're sacrificing a lot of normal activities that most of your peers are doing at this time in life. For many physicians, you're sacrificing your own mental health. And it is all because you chose to put your patients who are strangers to you, you chose to put them first. And the only way that that can be possible and the only way that it could feel worth it is to just truly love people. To quite literally put yourself aside and put somebody else first, again, takes true compassion and love for others. And I think that that is something that just isn't discussed as much because it sounds simple, but you do have to anchor yourself to something that makes it all worth it. And for me, I knew that just how much joy I get from helping people, from pouring into others, even from just talking to strangers on a day-to-day basis, that joy makes it worth it for me. That is my anchor. That's what makes it worth it to go into work every day and come back the next day. It's my love for people. And so yes, I married together my love for people and my love for STEM, and that made it quite easy to choose a career in medicine. Anyway, that's a little bit about myself and a little bit about why I chose to become a doctor in the first place. In my next video, I do plan on going into detail about the field of dermatology, what the practice of dermatology even entails, what drew me into the field of dermatology, and ultimately how I matched into dermatology, which is a really competitive specialty to match into. And so I certainly want to shine light on that. So stay tuned. I really want this channel to be about serving others. I would love to hear from you. Please comment below. Let me know what questions you have. Let me know what kind of content you want to see. Again, I just want to meet you guys where you're at and make sure I am giving you what you need and want out of this channel. So let me know. I really mean it. I will take all suggestions below.
Get it done.
So if you ask anybody, your first year of residency is arguably one of the most challenging years in your training. It is your first time truly being responsible for real patient care. You go from having a very nice and cush safety net of being a student and honestly just not having as big of a role in patient care to legit being the primary care provider of an entire patient team. Like, your patients' lives are truly in your hands now. It's pretty shocking and it's challenging. It's just really challenging. Hospital culture just isn't rainbows and butterflies. In some places it can be quite malignant and exhausting. I mean, you are working 80 hours a week. You are dealing with a lot of death, a lot of really difficult conversations. And again, this is all in your first year of practicing medicine. And so in general, it's just a really tough transition to make that all doctors have to make one day. But overall, it's also very rewarding to get that one patient who tells you that you're the first doctor to ever listen to them. It's those little successes, those moments are very rewarding. And again, it's just really important to hold on to your why when medicine gets really tough. And that's very often, unfortunately. Okay, so enough medicine talk. I am a big proponent of life outside of medicine, especially as a busy resident who works sometimes 80 hours a week, because my hobbies and activities that truly make me who I am and make me happy are things that I have to prioritize and be super intentional about if they're actually going to ever get done. Some of my hobbies include creating content, which I said for the longest I would finally take seriously, and so this is me doing just that. I just want to give back and reach as many people as I can. If I can change the life of one individual, if I can help one person in their decision-making process, if I can help one person get into their dream career, then I am doing exactly what I came here to do. I also enjoy sculpting and drawing and doing anything that exercises my creativity. It's actually one of the reasons why I chose dermatology. I also love just staying connected with my family and my friends, the people who recharge my soul. I love makeup, I love skincare, I love mentoring students. I can't even count the amount of times a mentor swooped into my life, whether it be transiently or not, and literally saved me. The value of mentorship is truly immeasurable, and I always knew that the very, very least I can do to give back is to literally do what many people have done for me. If you feel like you need a mentor, if you feel like you have a few questions right now that you really want answered, follow the link in my bio, check out my Calendly, and I have a free 15-minute mentorship session. I know it's not long, but I want you to come with very specific questions that I can answer very briefly for you. I probably have the answer, or I can point you to some type of resource that would be helpful for you. Sign up for a free one-on-one initial mentorship session, and I will do my best to meet whatever need you have right now. Follow me on TikTok if you want more day-to-day content. I got you. Follow me on TikTok. That's where you'll get more of me. Again, my name is Dr. BiBi, and it is so nice to meet you all. Stay tuned. I'll see you next time. Do I really need to be wearing a white coat? I literally never wear my white coat in the hospital. I just don't. Like, I don't want, like, people to point at me and make me, like, run codes on every floor or something. Oh, that's how that works.